Mrs. Angela Bianco has been admitted to the hospital surgical unit for a compound fracture of the tibia due to a skiing accident. During surgery, Mrs. Bianco lost a considerable amount of blood, and her blood work confirms anemia. Her attending physician prescribed a red blood cell unit to be administered today. Cross-grouping has been performed pre-operatively. Mrs. Bianco is receiving an NaCl infusion, pumped at a flow rate of 75 milliliters an hour. The nurse then proceeds with administering the packed red blood cells. The medical prescription in the file shows the product and quantity to be administered and any required medication before and/or after the transfusion. The infusion rate may also be indicated. The nurse assesses any previous blood transfusions or other blood products and checks for any undesirable reactions following the reception. She inquires about this with the user, as those having had previous undesirable reactions are more prone to repeat. When she is ready to administer the red blood cell unit, the nurse orders the prescribed unit from the blood bank. Blood products, such as red blood cells, platelet concentration, and plasma, must be administered as soon as possible after reception from the blood bank. The nurse checks the various parts of the red blood cell unit with a second nurse. One of the verifiers must be the person who administers the transfusion. This double check is mandatory to make sure the right blood product is administered to the right user. The nurse simultaneously checks the information on the red blood cell unit and transfusion label. They check the user's last name, first name, and file number, the product name, blood type, and Rh factor, the donation number, as well as the product's expiration date and time, its appearance, and other associated qualifiers if necessary. If there is discordance between the red blood cell unit and the label or any doubt regarding the unit's integrity, the procedure must be stopped and the blood bank notified. The nurse primes the filter tubing once the pre-transfusion check has been completed. For the priming procedure, the nurse wears non-sterile gloves to prevent contact with the blood and potential transmission of pathogens.
Hello, Mrs. Bianco.
Hello.
My name is Maria, and I'll be giving you your blood transfusion. This is my colleague.
Hi.
Would you please tell me your full name and date of birth?
Yes, of course. My name is Angela Bianco, and my date of birth is August 1st, 1970.
Perfect.
Upon arriving in the room, the nurses perform hand hygiene. They then confirm the user's identity, asking for her full name and date of birth and comparing them with her identification bracelet. This double verification of the user's identity further reduces the risk of error. After the identity check, the two nurses sign the transfusion label. The signatures are confirmation that the product matches the user. Also, this confirms that the double verification was performed and the blood product corresponds to the information on the transfusion label.
I'm now going to check your vital signs. I'll be taking your vital signs before starting the transfusion 15 minutes into the procedure and at the end. That is part of the blood product administration procedure.
Okay.
You don't have to worry, it's procedure, it's completely normal, it's the establishment's procedure.
Okay.
Checking the user's vital signs before the transfusion establishes the base values to be used during the procedure. Vital sign checks at various stages of the transfusion allows to detect any changes in the user's condition and thus prevent undesirable reactions. Moreover, the nurse analyzes the collected data to make sure that the user is ready to receive the transfusion.
Perfect. Your results seem perfectly normal. Now, I'll check the infusion site for your solution to make sure it's permeable.
Good.
Do you feel any pain on the site?
Nope.
Okay, perfect. I'll proceed now with the installation of the transfusion. If you have any questions, don't hesitate.
Verification of the infusion site is required before starting the infusion. This is to make sure the red blood cells are injected into a vein. Also, conferring the primary infusion is essential to be able to react quickly if the user undergoes a transfusion reaction. Administering the red blood cell unit as a secondary infusion makes it possible to stop it at any time and start the primary infusion if necessary. Note that for red blood cell transfusions, the primary solute is always NaCl 0.9%. The nurse uses the proximal Y insertion site of the primary infusion tubing to administer the red blood cell unit as the secondary infusion. She selects this site because it is the most direct access to the user's vein. Disinfection of the insertion site with an alcohol swab must be done for 15 seconds before connecting the transfusion to the primary infusion. Disinfection prevents the potential introduction of pathogens in the bloodstream. Allowing 30 seconds to dry ensures the alcohol's antiseptic effect. The nurse removes the protective plug from the male connector of the red blood cell unit's tubing and adjoins the proximal Y connector of the primary infusion tubing, making sure to avoid contamination. Using a needleless device helps to reduce the risk of accidental pricking and/or contamination of the healthcare worker. The nurse moves the flowrate slide clamp of the primary infusion tubing as close as possible to the proximal Y connector and shuts it off. This prevents the blood transfusion from refluxing into the primary infusion tubing. The nurse uses the volumetric pump to administer the infusion. The blood transfusion should be started at a low flow rate due to the fact that the transfusion reactions occur at the start of the infusion. Refer to the protocol in force in your establishment to set the flow rate. Moreover, the nurse should be aware of the user's medical antecedents, as this could affect the infusion flow rate. The nurse opens the slide clamp of the transfusion filter tubing and starts the infusion with the volumetric pump. This launches the administration of the red blood cells. When checking the user's vital signs 15 minutes into the transfusion, the nurse compares that data with the data taken before starting the transfusion. If the vital signs are stable and no undesirable reactions occur, the nurse can increase the volumetric pump flow rate according to the protocol in force. Recall that blood transfusions must be administered within a maximum 3-hour window unless otherwise prescribed by a physician.
Okay, perfect. There, the transfusion has started. I'll be leaving now. Here is your call button. If you need something or if you start to feel unwell, you just press it. I'll be back in 15 minutes to take your vital signs.
Very good. Thanks.
Okay, I'll see you in a bit.